All right, I think we can get started. Good afternoon and welcome back to the fifth annual Workplace Mental Health Conference. I hope you had a nice break and are ready to learn some new things during the session. My name is Cinziana Lucian. I am the Senior Director of Healthcare Initiatives for the Detroit Regional Chamber, and I will moderate today's session. The Chamber's Health Initiatives team focuses on convening and educating employers around health and well-being to improve outcomes in the Detroit region. And I've had the pleasure of being a partner for this conference for 4 years now, promoting our wellness platform called Wellness Works, which offers an array of complementary health and well-being resources for employers and employees. Danielle mentioned resource partners earlier, but please visit Wellness Works Detroit for more information. So we have a great discussion planned for you today around substance use disorder in the workplace, a topic often not talked about enough at work. We will explore the impact substance use disorder have on the workplace and how to provide support to employees around this topic. One thing to note, please submit any questions for our speakers through the Q&A function, and we will try to answer as many of your questions towards the end of the session. So now it is my pleasure to introduce Keosha Banks. She serves as project manager at the Center for Health Equity Practice for the Michigan Public Health Institute, MPHI. Keosha holds a BA in psychology from the University of Michigan and an MPH from Drexel University. Additionally, Keosha is a certified health education specialist. Welcome, Keosha. And then we also have Julia Isaacs as the Director of Behavioral Health Strategy and Planning for Blue Cross Blue Shield of Michigan. Julia is responsible for designing and implementing the enterprise-wide behavioral health strategy. She has more than 20 years experience in behavioral health, clinical, administrative, and policy work. So welcome, ladies. Thank you for being with us today. I know the audience is excited to learn about substance use disorder and how to support employees. So I will hand it off to you and we'll be back a little bit later for our Q&A session.
Thanks so much. So I think that Keosha is going to pull up our slides. So thanks again for having us here. I am very excited to have this opportunity to talk about substance use disorder. I feel like for the last 5-ish years, we have really doubled down on our focus on behavioral health in general. But I do sometimes feel like substance use is the sometimes not talked about as much, and I'm excited that we are specifically focusing on that. Today, we are going to talk about an employer's role in providing support. So at Blue Cross, I do work with a lot of our group customers, and there's always lots of questions around substance use. How do we treat it? How do we help our employees find resources for substance use disorders or substance misuse? So today's session is going to cover a variety of things. So just a high level kind of SUD and what we are seeing both at Blue Cross and across the state and everywhere, what to look for in the workplace. So this question comes up quite a bit. So are we able to tell? How do we intervene? Some questions around that. Types of substance use disorder treatment programs I'm going to explain. And Keosha is going to go into supporting employees through Recovery-Friendly Workplace Initiative. That is a very exciting initiative, which you will hear more about. And then last but not least, kind of resources and how to learn more. So there are a number of resources. Usually we find people don't know those resources. So we want to remind everybody of those, what's available publicly and what may be available at places that you might work. So if you go to the first slide, so I'm not going to spend a ton of time on this. You guys know what substance use disorders are, or you probably wouldn't come to this session. There's a number of ways that we categorize substance use disorders and substance misuse. I like this list of 7. There's different ways to do it because it specifically calls out nicotine, alcohol, cannabinoids, hallucinogens, opioids, depressants, and stimulants. Sometimes they get bucketed together a little bit more. And the thing that I think that we should all remember is that this is a treatable illness. Substance use and substance misuse and disorders are treatable illnesses and can happen anywhere. So an SUD disorder is defined as the use of alcohol or other substance that leads to health issues or problems at work, school, or home. We try not to wait until significant problems arise, but technically a disorder happens when there are those instances where it does impact daily life and functioning. But again, that these are treatable. So there is this idea that people can't recover from serious illness. They have a substance use disorder, and that's simply not the case. There's lots of people that recover. Most people actually recover in the numbers. So important to know and important to remember. If you go to the next slide, I'm going to say a little bit about prevalence, both kind of what we are seeing from the data that I have available to me and what we are seeing nationally. So substance use disorders are caused by multiple factors, as you can see on the screen. These include genetic vulnerability. If there are folks in your family that have substance use disorders, you potentially have an increased probability of having a substance use disorder, but nothing is 100%. But that is one factor. Environmental stressors, what environment you grew up in, what environment you live in, where you work certainly plays a factor. Social pressures, who are you hanging around with? Are you hanging around with people who drink a lot of alcohol, who do illicit drugs, who maybe misuse prescriptions? Those social pressures can be pretty powerful. And then individual personality characteristics, and last but not least, psychiatric problems. So just at a high level here, you can see that in our data, I wanted to share with you guys that 25% of all behavioral health emergency visits are related to substance use disorders last year. Overall in the country, there's about 49 million people age 12 or older who have a substance use disorder. And one little glimmer of hope I want to just say, because this slide is a little bit outdated. So in 2022, there were about 107,000 overdose deaths related to a substance use overdose, which was an increase from the previous year. But the latest data in 23, for the first time in many years, is showing, the preliminary data is showing a decrease. So we are cautiously optimistic that that treatment is working, and we are providing the right kinds of services and prevention to prevent people from overdosing. And then lastly, here on this slide, you can see that a big proportion of people who have a substance use disorder don't get treatment. So the numbers for mental health conditions are around 50%, depending on the population, but many, many more people who have a substance use disorder or misusing substances just don't get treatment. And as I mentioned before, these are treatable illnesses. So, we want to make sure people do get that treatment. So what to look for if somebody has a substance use disorder? I think this is a question that I get a lot, and I don't think it's necessarily always a fair question, because I think a lot of times people are looking for these really dramatic changes where people are not able to function. If you've known someone who has a substance use disorder, you understand that things can be a little bit more nuanced than that. But overall, high level, this is not everybody. You could see things like poor decision-making, difficulty with planning, irritability, kind of changes in mood and overall frustrations. There could also be physical changes, so bloodshot or dilated eyes, wearing glasses, drastic changes in weight loss or weight gain, unusual smells, things like that. So there are lots of ways that you can potentially see, but just to be totally honest with everyone, a lot of times you don't know. There's lots of people, most people who have a substance use disorder or misusing substances, it is more challenging to tell, particularly in the workplace. So I just wanted to, be clear about that. So if you go to the last slide here, so I'm just going to not talk about this very overwhelming slide. I know when I first showed the planners this slide, they kind of went, "Oh my goodness, this is too much." I show this slide only to say that there are lots of levels of care and treatment that are available for most folks. So I think a lot of times when I'm talking to employers and I'm talking to HR teams, their vision of substance use treatment is something like either they go to AA or we send them away long-term to a residential facility and they go away for about a year. Those are very, very different ends of the spectrum. And what we do find is if we can get people into the right level of care, we can get them better quicker. So if you look at this, this graph here, right, I don't know if I'm pointing in the right direction here, depending on what you guys are seeing, but On one side, we have kind of medical detox, subacute detox. These are hospital level levels of care that are required for someone to be safe when they are detoxing. We have inpatient and residential treatment. But we also have things like partial hospital. So partial hospital is something where somebody goes during the day, they still go home at night to their families or their friends, and they stay a couple weeks, maybe a month in those programs. Another really wonderful treatment option is intensive outpatient care. So this is actually about 3 hours a day, 3 or 4 times a week. A lot of times these programs are actually available kind of after or before working hours, so people can actually still maintain their employment and get the treatment that they need. And then moving on to those lower levels of care, outpatient care, and even care from our primary care physicians. There is this kind of thing at the bottom that says remission. PCP is primary care. So primary care provider, sorry to use acronyms here. We use a lot of acronyms at Blue Cross. We do anticipate that a lot of times people will have a recurrence. So we, want people to get to remission. We want to respect and support harm reduction measures in substance use treatment. But again, these are treatable illnesses, destigmatizing treatment for these, and also just having a basic understanding at the workplace of what is available. Because again, I do think that many folks are scared. They don't want to get sent away from their families for long periods of time. They're not that bad, kind of this, I'm not that bad. So understanding that there really are evidence-based treatments kind of across the spectrum to help people in their lives, I think is kind of what I wanted to make sure that this group understood. So with that, I am going to turn it over, I think, to Kiosha, who's going to talk more about recovery-friendly workplace and how people could get involved in that.
Awesome. Thank you. So just to transition, we're going to talk a little bit about how the Recovery Friendly Workplace Initiative, how it got started, what does it mean, what is it addressing. So I'll just kind of start with giving you a little bit of the history. It was established in New Hampshire. It was 2018. The Governor Sununu, began Recovery Friendly Workplace Initiative. He was operating a ski resort. He owned and operated a ski resort, and just realized that there was a big challenge with substance use, and just trying to figure out ways to support employees who had substance use disorder and or were in recovery. And so it kind of got adapted there started there. And then here in Michigan, we started it in 2022. We received a SAMHSA SOAR grant, and through MDHHS, and the Michigan Public Health Institute is the organization that's responsible for taking this initiative on. The goal is to help businesses develop recovery-friendly workplace cultures and promote health, safety, wellness for Michigan employers and employees. And I think it's really great that Julia went before me to kind of talk about what substance use is, what substance use disorder is, and kind of how it shows up. Because a lot of people spend a lot of time at work. And so we talk about different pathways to recovery and different things that can be put in place to support people who are in recovery. And we believe that establishing some supports in their workplace is definitely a way to help folks as they're going through their journey of recovery. And so, as I mentioned on the previous slide, this initiative started off in New Hampshire, but it's grown. So this isn't the most up-to-date graph or map, but you can see each state is implementing this initiative. And then it's also gotten to the point where there's a state or a country level center, basically, that allows for companies that are across the state. So for example, like Google, they don't just have organizations or stations in one state, but they can also become recovery friendly by working with the US level of the Recovery Friendly Workplace Initiative. And so in I guess 3 words, we like to say we acknowledge, we educate, and we offer support. So we acknowledge by providing the employees with this understanding of or employers with the understanding of SUD, how it shows up in the workplace, what is recovery, what's the process, just making sure that we acknowledge what SUD is, what recovery is, and how it shows up in the workplace. And then the education component is just educating personnel to assist in providing better understanding of the disease and how they can help. And then we offer support to both the employers and the employees by focusing on safety and wellness of their staff and how they can make a better impact. And so, because of our time today, we won't go into a ton of detail of all of the steps of becoming an RFW, although there are not many. But we did want to make sure that we talked about the benefits of becoming a recovery-friendly workplace, which I do want to just quickly mention. It's open to any organization. I just had a question about this before yesterday, asking like if it's just certain industries, and any organization, large, small, mom and pop shop, all the way to a large organization can become a recovery friendly workplace. And basically you would receive support at no cost. So because this project is grant funded, we're able to supply you with the resources and the training at no cost. Additionally, getting connected to important information and training. So there are 3 trainings that are considered required as a part of becoming officially designated as a RFW. So we provide those trainings to you. We also have a few other resources that are available to you as well. And then you do receive recognition from the Michigan Department of Health and Human Service. And that recognition is basically a letter stating that, we recognize that you've gone through this process. And we also get a certificate. You would get window clings so you can post them at your job sites. And then a thing that I really love about the benefits is being advertised on our recovery friendly workplace website. So we do have a website, and there's going to be, once we start, right now we have 2 organizations in Michigan that are officially designated. And so we're working on getting them added to the website. But basically, it's a career page where people who are in recovery can come to this page and find organizations that have shown that they support their recovery. And they can apply for jobs, they can reach out to those organizations. So I really think that's a cool benefit to being an RFW. And then access to continued resources. So this initiative has been going for a couple of years now, and we're learning, and we're building up our resource bank, and there's more people that are interested in becoming RFW. So our goal is to continue to connect folks, provide mentorship, provide guidance in the entire process of becoming. And then once you already are a RFW, just making sure that you have the resources that you need. If certain legal questions come up, if certain concerns come up, we want to make sure that you have the support that you need to address those. And so just speaking specifically to the Recovery Friendly Workplace Initiative, I want to make sure I leave you with some next steps. One of them being, we do have a monthly RFW newsletter that goes out. You can go directly on our website. I don't know if I can drop it in the chat, or maybe I can do it after the presentation. But basically, you can go on there, scroll to the bottom, and be added to the newsletter. And this way you can stay up to date on what's happening with the initiative. And then also, if you feel like your organization, whether you're in the leadership role of your organization or not, if you feel like this is something that would be beneficial to the employees and the employers, we invite you to complete a letter of interest. So I'm gonna I'll speak to one of these resources, and then I'm gonna pass it back to Julia. I wanted to just pull out, if you can see underneath, it says guide employees to available resources. There's a Shatterproof Just 5. So as a part of the RFW initiative, you can actually find this link on our website under all of the other resources. But we were able to partner with Shatterproof to be able to provide some short 5-minute video clips that talk about SUD, talks about how they show up in the workplace, talks about how to be a supervisor of someone who might be in recovery. And so these are offered for free. And we would love it if you would watch them and share them with staff, employers, employees. They're a really good resource just to get everybody on the same understanding. And there's a lot of stigma associated with SUD. And one of the biggest things that helps people be successful in their recovery and in their experience with SUD is kind of taking away that stigma and giving people the support that they need. So I just wanted to highlight that. Then I'm going to turn it over to Julia to highlight the others.
Thanks, Kiosha. Yeah, as I mentioned before, we are, at Blue Cross and in lots of the work that we do a lot of resource gathering and building and relaying of information to our HR our groups and our HR professionals that we work with. So knowing what is available to your employees is really, I think, critical. And as Kiosha mentioned, trying to break down some of that stigma is really helpful. It's just so powerful, and people tend not to seek care even when they really do need it. So one thing that I think there's a big misconception about, and I know I'm talking to a lot of HR folks, is the employee assistance programs. So if your employer, if your company has an employee assistance program, I don't think that people realize what a great resource that is for assessments, for no-cost services to kind of get them started. I think a lot of times when people hear about employee assistance, they think they're getting sent there for like a punishment or something, right? So I do think that we need to kind of flip that script. Like, this is not you're going there to get an eval because you're in trouble. This is a place that actually is supposed to provide assistance. So knowing those and knowing what resources your individual employee assistance program might have. So 988, the Suicide and Crisis Lifeline. I am still always a little bit surprised that still a lot of people don't know about this. I just had a meeting with a large group of some of our big customers before, and some of the HR folks didn't know. While we are talking about substance use, mental health conditions, and suicidality affects all walks of life, just like substance misuse does. So knowing that that is available 24/7, instead of calling 911, you can call 988 and someone is available 24/7, 365 to help kind of talk through any crisis that somebody might have, and then potentially connect them to resources that are available in their community. So the next one is behavioral health benefits through a health plan. I know that many employers offer several plans, right? You may have an HMO and a PPO, or you may have kind of levels that offer. But as I talked about previously, that kind of list of, all these different services, take a dive into your substance use treatment benefits. What is available to folks? A lot of times, because of mental health parity and because of the ACA and changes in that space, behavioral health benefits tend to be, they are at least as good as, if not more robust than your medical benefits. So I think people also are afraid it's going to cost me $1 million and I can't go. So understanding what those benefits are and what the potential out-of-pocket costs might be for your employees, because that's always a question that we get. Virtual and in-person AA and NA meetings. These are still going on. Many people find these helpful. I think the virtual option that really popped up during the pandemic has been hugely successful. I do think there's something about going in person and having coffee and having snacks, but really I've talked to a lot of people who have still found that community feeling in the virtual visits. So I think it was a little bit of an experiment, right? Are these virtual visits going to work long term? And we have seen that a lot of people still find the same satisfaction and feel like they have built a community of people who are in recovery that they can talk to. This is probably, I don't have to say this, but I'm sure making sure that employees and family members know where they get those services, that they can utilize them and how they have them. Digging through your benefits and trying to figure out what you have is really stressful, especially if you're in a time of crisis or somebody's very unwell. So making sure that employees have a kind of easy way or a reminder, or there's assistance available to understand what the resources are that they might have, either through their health plan or EAP. On the other side here, just Family Medical and Leave Act, so encouraging utilization for this if they need this. Substance use disorders are conditions, right? They are, people are able to use family and medical leave for the treatment of these conditions. I don't think a lot of people think about that, but there are options if somebody does need to take a leave of absence and they're very afraid to do so because they're going to lose their jobs. There are opportunities for people to get the care that they need if they do have to focus on their health and well-being so they can come back and be the best employees possible. And then last on here, I just want to share, this is a public resource. This is not a, specifically Blue Cross. We made this at customers' request. So we had a lot of large group customers, a lot of ones with like big factories that were really struggling with opioid misuse in the workplace, can be a danger to people, obviously. So in any case, this is free, watch it, enjoy it. It's kind of interactive. You can like look at what drugs are. It's pretty cool. So free resource available for anyone. And I think that's all we have. So Kiyoshi and I are happy to answer questions.
Thank you, Julia and Kiosha, for the valuable information you shared with the audience. Also, I love all the resources that you provided. I know that our audience will, they'll have access to those resources after the session as well. So let's jump into some questions that we have from our audience. First, I'll start with you, Julia. So can you talk about specific reasons why substance use and substance use disorders have been on the rise in recent years? So why are we seeing some of, these jumps in these cases?
Yeah, so I mean, I don't want to blame everything on the pandemic because that wasn't always the problem. Because even pre-pandemic, I would say the one that you can point to most robustly is probably the readily available increase in prevalence of synthetic opioids, right? So, heroin has been around for a very long time. Fentanyl, which is one of the kind of primary synthetic opioids that has seen a dramatic increase, is 50 to 100 times stronger than heroin. So we used to see things like addiction with heroin. Obviously, it's still a very addictive opiate. We used to see overdoses, but it's just not even in the same realm of, the world. So they're cheaper, they're easier to get, and they're just really highly addictive. So I'd say that. Other thing I would just mention is my favorite thing to talk about, because I don't think that we bring it up enough, is alcohol, right? So if you look at the increase in alcohol-related deaths, alcohol-related medical conditions, since in the last 5 years, it's been about 30%. In the pandemic, we saw huge increases. There was actually some research out of the University of Michigan around women and increases in medical conditions caused by alcohol misuse. So I think there's lots of reasons. I saw somebody put in the chat something about meth. I think interesting it is, I have this dashboard where I can look at kind of utilization rates and things just in our, from Blue Cross Blue Shield of Michigan. And we do see kind of like trends, right? So we saw a huge decrease in methamphetamine use. We're seeing that rise. We're seeing an increase in cocaine use, but some decreases in opioids. So I think they kind of ebb and flow, but I think it has to do with access and environmental circumstances and what's going on socially and economically in the country.
Thank you for that. And I'm glad you mentioned alcohol as part of substance use disorder. I think a lot of people don't associate alcohol in that category. So thank you for bringing that up. I think, alcohol usage has increased, vastly since the pandemic, and that's definitely, categorized as an SUD. So, all right, let's go to Kiosha. So we have a question here about the Recovery Friendly Workplace Initiative. And thank you for sharing all the important information about how to get involved. But can you share more specific information about how to become one, Recovery RFW? And
Yes.
also, what about organizations that are located outside of Michigan? So we had a question about, what if you're not in Michigan or New Hampshire? How can you access this program?
Okay, I'm gonna skip over to the next slide too, because it has like that contact information. Um, and then I can answer your question. So the first thing to do would be to scan this QR code, and then it'll take you to our website. On the website, we do have the letter of interest, but we also have a checklist. It pretty much has three components. The first one is just the initial steps, which is to go ahead and fill out that letter of interest and set up a conversation with myself or my colleague, Nikki. And we'll have that initial first step of like, what is RFW? Who needs to be in the trainings? What does it look like to go through this process? Within that conversation, we also take you through sort of the next step, which is making this declaration to your staff that we are going to go through this process of becoming an RFW. We do have a statement that you can use or you can create your own. And then the next thing is scheduling the training. So there's an orientation and there's also 3 trainings. There's one training that takes an hour and a half, but the rest are an hour. We've been able to accommodate everything from in-person half-day trainings to people just doing the trainings virtually. So every month we do post a new training schedule on the website that people can sign up for based on their availability. Or as I mentioned, you can work with us to schedule something that is tailor-made to your organization. And in these trainings, we really get into the nitty gritty of what is SUD and how does it show up in the workplace, what resources are available in your area, what resources are available across the state, what does it even look like to become an RFW? So we provide examples of different workplace culture shifts that might need to happen. It was mentioned earlier today, like alcohol being a part of the list of substances that someone can be having a substance use disorder associated with alcohol. And one of the things that I've heard is, there's a lot of companies that have social events where they have happy hours, or this particular company mentioned that during the pandemic, they did a virtual wine tasting. If you have people in recovery that are employed at those organizations, that could be a trigger to set them in the wrong direction in their recovery. And so during the trainings, we talk about some of those things that can be a trigger, and we work on fixing them so that they can be more of a supportive work environment. Maybe we don't have everything is happy hour. Maybe sometimes we just go bowling and there's no alcohol available. So we work through some of those examples. And then after you do the training, it really is just kind of like those little fine paperwork things. So you complete an application. The application is basically the checklist saying that you did all those steps. You get officially designated through MDHHS. You receive your welcome letter, your window cleans, your certificate, and then you would send us your logo or your link to your career page, and we'll have you on the website. After that, you're an official organization that's considered RFW, but we do want to make sure that you always have that support. And so we do have little trainings that we'll do or webinars that we'll do throughout the years that connect you with other RFWs or connect you with like we've had a lot of questions about like policies and laws and different things. So we want to make sure that we're connecting you to a lawyer who can answer those questions that you might have about, if I become RFW, can I do this, or can I not do that? So that's the general concept of how to become an RFW. And then to answer the question about if you're an organization that's not in Michigan, if you're a part of any of the other states that I showed on the map, you're welcome to reach out to us and we can connect you to the folks that are in charge of leading the initiative in those states. But if your organization has offices throughout the United States, we can connect you to the higher level organ. There's a cross state organization that's running this initiative for those organizations. So we can make sure we connect you to the right organization, the right people that are leading this initiative in whichever state you are in.
Thank you, Kiosha. I think you hit on a lot of the questions that are coming in, especially, some comments about, companies using happy hours, and things like that. So thanks for talking about that.
No problem.
All right, let's talk about stigma. Julia, I have a question for you about, I know you talked a little bit about stigma, but what about, let's say, I think a lot of employers, don't think they have an SED problem in their workplace, because people are scared to come forward and talk to HR or their bosses about their challenges. So can you talk a little bit about, workplace stigma around SUD and how can employers create that supportive work environment that, allows conversation and people to come forward?
Yeah, so I think that everyone has a substance use disorder problem in their workplace. Because if we look at the numbers, if we think maybe you're in an itty bitty company and that's not true, but if not, you just kind of look around and it's probably somebody, right? They're much more common than you would think. So I think having an assumption and treating it in a very kind of matter of fact way. So, we have been doing, I think, a really good job lately of talking about mental health, of talking about stigma related. We never talk about it as it relates to substance use disorder because there's still such a stigma of you're doing something wrong, you're drinking too much. It's similar to how it used to be, and in some places still is with mental health, that you're doing something wrong. There's something intrinsically wrong with you that you should be able to control and you don't. So I think having the conversations, Cynthiana, like we do with mental health and like we talk about wellness and also identifying substance use disorders as diseases of the brain, that these are medical conditions like any other condition, that are treatable like anything else. I don't think that we would, shame folks. I hope no one's shaming anyone for having diabetes or, having cancer or something like that in the same way that they would with substance use disorder. So I think talking about it more and not less, and kind of normalizing those conversations. And, if you're a recovery-friendly workplace, I think that's great because then you can understand that, people are committed to you and your well-being and, you feeling better and being your best self.
I love that. Thank you. And, obviously there's an array of resources that you shared and that are also available out there to help employers, have those conversations with their employees, and, provide those resources and support and get started. I mean, there's always a starting point. So,
Yep.
Thank you for that. Okay. So we do have a question, about marijuana, / cannabis. So where does this disorder fit into the workplace support discussion? As part of SUD, and then also, are there examples of programs in this area or resources?
I'm assuming that's a me question, Kiosha?
I think so.
Yep.
Okay.
I know it was on your slide. when
Yeah,
you
so-
spoke about the different ones.
Yeah, I just didn't want to step in and say, so I think we treat cannabis like we treat anything else, right? Obviously, here in Michigan and in a number of states across the country, cannabis use is now legalized for recreation. So we have seen an increase in use across the board. There are some people who misuse cannabis, who overuse, who can't stop using, who have a disorder because it affects and impairs their ability to function in various areas of their lives. I think that's a similar conversation to alcohol, to other substances. So I wouldn't put it necessarily in any new kind of category or treat it differently. But I do think that we need to, continue the conversations that, maybe a little bit is fine if it's legal and there's, if it's allowable and things like that. But when it starts to affect your work, when it starts to affect your family, when it starts to affect your relationships, then it's no longer okay, right? So I think those conversations are a little bit newer now that there's more legalization across the country, but I think we have to continue those conversations.
I agree. Thank you for that. I think there's a lot of crossover between all, the SUDs that you mentioned.
Yep.
Treating them kind of the same is the best approach. So thank you for that. Okay, Kiyoshi, I do have a question for you.
Okay.
And I know we're running out of time here quickly. So one more question and then we'll wrap up. So could you share your experience with organizations who offer on-site recovery support groups, either using peer recovery specialists who are employees or partners?
Yeah, so we've had a couple of organizations that have gone through this training. I won't say their name because I didn't get permission to do so. However, after the training and they learned a little bit more about SUD, let me back up. Before the training, they said, we don't have a problem here with stigma. Like, we're recovery friendly already. Well, turns out there was a lot of stigma in the language that they spoke, in the way that they address SUD. So once we got past that and had a real conversation about stigma and changing and shifting that culture, there were actually about 6 people that came forth and let their supervisors know that they were struggling with SUD and they were having a hard time in their recovery. And so, because we were already partnering with a recovery community organization, we were able to connect that organization that was becoming RFW with the recovery community organization that provided that peer recovery support coaching on site. And so it was extremely successful because they, as an employer, you're always thinking about like, okay, if I let you not work, that's productivity, that's costing. But instead, if we can bring support to our office, we can have group sessions during normal lunchtime, or we can make small adjustments to the workday schedule to make sure we provide the support that our team needs. And so it's been extremely successful as far as having that support being brought in. Um, and I think the more, like Julia said earlier, like the conversations have to happen. When the conversations happen, you realize, like, oh, wait, maybe we do have an issue here that we're not addressing. And so the more you have that conversation, the more you learn about SUD as a disease, the more you learn about the stigma and trying to work around reducing that stigma and changing the wording that you're using, the language that you're using, the more people are able to help their employees that are in recovery, because numbers are telling us there are people at work that are in recovery. It's just inevitable. So I
Yeah.
hope that answered the question.
Can I add something, Kiyoshi, real quick?
Mhm.
Yeah. So I 100% agree with her. And I just think that there are so many opportunities for all of us to use the words. I mean, we talk about now, like, we're struggling. You can talk about to your employees, like, everybody remember the pandemic? Remember how much drinking not everybody, but a lot of people started doing? I was finding that I was drinking, every night. Like, I'm having wine, I'm having a glass of wine every night. If I only have one, I go out with my friends and now we're going nowhere. So again, finding places to like have those conversations and insert them to normalize, and then I realized I had a problem, right? So I think that's a really great place to start.
For sure. And I think if, employers would be surprised if they start having those conversations, how many of their employees are actually, facing challenges around SUD. So, I completely agree. I think that's a good place to start. All right, ladies. Well, we have 1 minute left. So rapid fire kind of takeaway, for our audience. Yeah. What would you leave our audience with?
I'm
Julia?
gonna say,
Or
oh,
Kyoto?
you want to go first?
Yeah.
Okay, I can go first. Really quick, check out the RFW website and definitely join the newsletter, because even if you're not sure if you want to go down the road, I think just being aware of what's happening in Michigan and all over related to this initiative would be beneficial.
Yep. And I would just say know what resources you have available through your organization and how people could get it, so that you can give it to them quickly, because usually when people are ready to get help, they need to go right away, right? We don't want to say, oh, get help, and then you can go 6 months from now. So really understanding what is available through your organization and through your community.
Awesome. Well, thank you so much. Thanks for your subject matter expertise, and thanks for everyone tuning in. And stay tuned for the next session. Thank you.